Now we will talk in our second section of the lecture, Premalignant Diseases. We will talk about the Vaginal Intraepithelial Neoplasia. Like in the last section, we talked about the vulval intraepithelial neoplasia, and then we talked about how it presents and how it is diagnosed and managed. Now we will talk about the vaginal intraepithelial neoplasia. All these come in the pre-malignant diseases because they can lead to malignancy if the treatment or if the diagnosis is not performed early. So it is very important that we should know about the early signs, symptoms, and presentation of the patient. So in this, we will talk about how vaginal intraepithelial neoplasia, and we will talk about what's the pathology. Pathology is abnormality, any abnormality, study of the abnormality. Like physiology is the study of normal functions. Pathology is the study of any abnormality. And then also histology is the study of tissues. Cytology is the study of cells. So ology is the study. Patho is disease. So we will talk about what are the different abnormalities of vaginal intraepithelial neoplasia. Then also we will talk about how we diagnose and manage vaginal intraepithelial neoplasia. So let's start with our section, Vaginal Intraepithelial Neoplasia. And first, the important thing is the etiological agent is HPV, human papillomavirus. Human papillomavirus, oncogenic. Oncogenic means it's capable of causing neoplasia or malignancy. Oncology like is the study of cancers. Oncogenic means capable of causing cancer. So HPV stands for human papillomavirus. Here, this is the vaginal canal, and this is the picture showing the development of cancer or growth of cancer in the vagina. This is with cancer. So let's see, this is all the growth is starting. Then it gets bigger, and then slowly, if you see in this picture, it starts spreading beyond the vaginal canal, and it's spreading to the lymph nodes and surrounding area. So beginning is a lesion is small, and then slowly it starts spreading more and more. So the causative aging is oncogenic HPV or human papillomavirus. Then what's the pathology of vaginal intraepithelial neoplasia? It's again type 1, vaginal intraepithelial neoplasia 1. There is, like we said in the vulval intraepithelial neoplasia, we talked like it type 1, there was mild cellular atypia. So same in the vaginal intraepithelial neoplasia type 1, there is minimal loss of stratification and polarity. Polarity that keeps the cells together. Stratification is the regular growth pattern of the cells. So it's minimum loss. It's not as bad as slowly it starts progressing in type 2 and type 3. Then in type 2, there is epithelial abnormality of middle third of epithelium. So now it's progressing more. In the first, there was minimum loss. Now it's reached up to the middle third of epithelium. Then in type 3, there is carcinoma in situ. It's already spreading. It becomes cancerous. Carcinoma in situ is basically the carcinoma is limited to the site from where it develops. So first mild, then slowly it progresses and it involves the middle third of the epithelium. Then now it is labeled as carcinoma in situ or carcinoma in the site where the lesion is originating. Next, the diagnosis. Before we go over the steps, again, this is the speculum, vaginal speculum. Vaginal speculum is the instrument that is inserted to visualize the organs clearly, like cervix and uterus. And then this is the brush, brush to take the specimen for cytological studies. So this is the brush. Pap test. Pap test is done to find out any abnormalities in the cell of the cervix. So Pap test is regularly performed after the female gets sexually active. So Pap test is performed to remove the specimen from the cervix and it is tested. Brush is used for the cervix, which is the inner area of the cervix, and the wood is used for the ectocervix because that is hard and it's not easily capable of bleeding. So endocervix is used, specimen is taken from the endocervix or inner layer, inside of the cervix by the brush, soft brush. This is the vaginal speculum. It is inserted into the vagina after lubrication, and usually the position of insertion is sideways, and then once entered you turn it, position it there and then open it to avoid pain and injury. And then this is the position in which pelvic examination is usually performed, and this position is known as lithotomy position. The patient is on the back with feet in the stirrups and legs are bending or they are flexed. So this is the Pap test or position for the Pap test and the brush for the Pap test. The diagnosis is by the vaginal scrape cytology, and this is the diagram that's showing how the specimen is removed for cytology. So vaginal scrape cytology. Then colposcopy. Colposcopy is examination of the cervix with the help of colposcope. Then biopsy is performed to diagnose the vaginal intraepithelial neoplasia. Then management of vaginal intraepithelial neoplasia. Management is by local excision. Locally, as we mentioned in the vulval intraepithelial neoplasia, that local excision. If the lesion is local, then it is removed by the local excision or local removal of the tissue. Then the medicine used is 5-fluorouracil cream on the site where the growth is present, 5-fluorouracil. Then ablation therapy. Ablation is therapy when the ablative equipment is inserted and the tissue is removed. It's called ablation therapy. So management, local excision, 5-fluorouracil, and ablation therapy, which is done by electrocautery, and a hot instrument is inserted with the pointed hot end and the tissue is destroyed or removed. Also by laser. And then there is also excision of vaginal vault. So these are all the management techniques for the vaginal intraepithelial neoplasia, local excision, or 5-fluorouracil cream. Then we have ablation therapy, which is by electrocautery, by laser, or by excision of the vaginal vault. So that was all about the vaginal intraepithelial neoplasia. Thank you for watching sqadia.com.